Hello friends, so let's begin another session with Dr. Abhay while we are talking to him about diabetes, blood pressure and cholesterol. So let's begin for today.
The second question which you should have asked, but I will tell you, which I am asked by people, young people ask me that my uncle or auntie or XYZ relative is telling you are too young to start the hypertension medications because they are lifetime. So you
Yes.
are in young
Yeah.
age, don't start the medication. Now the answer is, if somebody is 25 years old and he wants to achieve 80 years of age, he needs more aggressive treatment and care than somebody who wants to reach 80 years of age from 60. He developed hypertension at the age of 60. If 25 years old does not take care of it, maybe at the age of 35, 40, he will have a brain hemorrhage, maybe dead or maybe bedridden. So he's waiting to become 50 to start the medicine. How he's going to reach there?
Right, right. Okay, I suppose if you can tell something about the data, which probably sort of people appreciate more as a common man, that I mean about the sort of damage or
Prevalence and
deaths
damage.
because of BP, directly or indirectly related. Because and the thing is that BP, they say, is a blood pressure. I mean, how does it matter? So probably we need to
Yeah,
understand
yeah.
what
I
is
will
blood
show
pressure,
you.
and then how it affects heart or
Yeah.
other symptoms of the systems of the body.
See, causes wise, sometimes we are not able to ascertain precise causes, but overall, it's a combination of genetic factors, and much more than that is a sedentary lifestyle, obesity. These are the things which are leading to it. If you are in an active lifestyle, which is going down these days, you can to large extent prevent it. Second thing is, people should trust that now I'm going to show the recommendation and data of the experts in the field leading. It is not my personal, whatever I am talking is nothing is my personal opinion. Now, I will show you some slides from the website of World Health Organization. We
Yeah.
need to trust after all somebody.
Sure, certainly.
So the blood, according to the World Health Organization, know your numbers. They say if your blood pressure is frequently 140/90 or more, probably you have high blood pressure. Consult your doctor and take a professional, allow him to take a professional decision for you. Now, 140/90 is a critical number whereby you should be on lifestyle changes plus medications, not only lifestyle changes.
Okay. Generally,
Because,
people think
yeah,
that after till 140/90, it's okay. After that,
no,
we have to think of medication. That is
no,
the
I will show
general
you the
perception which I have.
other numbers also. So this is a definition of the blood pressure, which was very popular, given by JNC 7, Joint National Commission 7 guidelines for
Yeah.
all adults aged 18 and plus. There
Okay.
is no separate recommendation for 60 years, 70 or 80 years
Yeah,
people. It is
generally we had
same.
that kind of thing that 50 plus age that much. So that notion is not there now. So this is the recent one.
That notion is very partially left now, to the extent that very elderly people do not sometimes tolerate a very aggressive lowering. So we will lower them gradually and probably slightly more than the younger people. So when you are treating the hypertension, your target could be slightly higher in the elderly population than the younger population.
Okay.
That is only, but diagnosis wise, there is no difference. It is
Okay.
same.
Okay. So this is a large misconception, I suppose we need to be cleared, as you clearly
Yes,
explained,
absolutely.
that with age, we do need not think that even if it is 140 or 150, it's okay. So that is a wrong perception here. That's what I suppose you're saying.
On the contrary, at older age is itself predisposes one to the risks of stroke. On top of that, there is a hypertension which is being neglected. So the immediate short-term risk of stroke is more in this elderly population who are under impression of their age, they are neglecting it, and you see how many people are getting a stroke,
Yeah,
most of
let's
these
talk about the
strokes.
data you were showing me once about talking about the data. Yeah.
Preventable. Now here I would like to show you that a normal blood pressure for everyone is 120 upon 80 or less only. That's all is normal.
Anything less
If
than
the
120, it may be anything less than one,
yeah.
maybe even 90 is okay.
Even 90 is okay, but if somebody had a known hypertension and he had a bleeding or excessive sweating during a sports event or otherwise because of professional work, and his blood pressure has suddenly dropped, then it becomes a low blood pressure and needs to be treated medically. But if
one is
somebody is
fine
having a
doing his job and he's
fine,
doing very good, then
stable
even if it is
person,
90, it's okay.
90/60 is normal. Many people have 90/60 as a normal reading. They are hale and hearty, moving around, smiling, laughing, joking. Fine.
That's a big clarification. There's a very big clarification, which I suppose
exactly
which is required with the people. So that's a very nice, sort of perception.
Yeah. Now the category of pre-hypertension, whereby systolic is between 120 to 139 and 80 to 89 diastolic. This is the group of people who are at very high risk of becoming high blood pressure patient in future.
Okay.
They need not start any medication, but they have the time, extensive lifestyle changes of weight loss, cutting down on salt, cutting down on cessation of smoking, reducing alcohol intake, regular exercise. These things help them a lot to either avoid becoming hypertensive or at least delaying the onset,
Right.
So that is one thing.
Yeah.
And these two stages are mainly for us only, because most of stage 1 people can be managed with single medication. Stage 2 will need a combination of 2 or 3 medication. So this is, but once you cross 140 upon 90, you must not try to avoid medication.
Okay. So we were trying to know about now, the data, which you were telling that how
little bit more I will show you. See, for general purpose, this is okay. But if you want to cut fine, this is the data of JNC7, the terminology by American Heart Association and American Stroke Association. They have little bit recently came out that even this category is stage 1 hypertension. So different societies have minor differences. Let us not go into the nitty-gritty of its minor differences between European, American, and different society. These are the nitty-gritties.
That is for experts, you people.
For experts, leave it for that. Yeah. Now, another thing, what about the prevalence? How common is the blood pressure? According to World Health Organization, of all adult world male population, 1 in 4 is suffering from hypertension.
Okay.
Most of them may not be aware of it, but this is the fact, And I am encountering it. I am sure if you talk to doctors in India, now this COVID-19 vaccination drive going on. Whenever anybody goes for vaccination, and I am sure in UAE, they are first checking the blood pressure and doctor talks about the history of chronic illness. Now, this has led to surge in the undetected hypertension people coming, because they go there, they are thinking they are healthy, their pressure is 160, 170, and then he says you are unfit for vaccination, they come to me for treatment. So my number of patients for hypertension as a result of vaccination screening has suddenly gone up by a big number. Okay. So that is helping us to.
It must be happening here also, I suppose.
I'm not aware of Indian data, but I'm sure what is happening here must be happening
I suppose, because when I went for my first vaccination, I saw a lot of people over there, and there's a lot of rush in the center here, and many people were sort of confused and in a bizarre state. How come my blood pressure is okay? Maybe अभी आलस से हो गया, यहाँ पे थोड़ा सा टेंशन हो गया, तो मैं बैठता हूँ थोड़ी देर. So I saw 2-3 people like that. So it gives an idea what you're talking is absolutely true, and must be more so here in India.
And this is the situation whereby they are very not very strict. And if your pressure is 145, 150, they are giving vaccination. For vaccination purpose, it is not a problem. But if you are having more than 150, then they are little scared to give. Because after all, please understand, this vaccine is also new. We do not have huge number of years of experience about safety. So these are the safety precautions which they are taking.
Right.
Then coming to women,
Okay.
20% of the
They're
women
safer.
also have hypertension. Yeah, they are
Mhm.
little less, but still, this is again, you can see from logo on the top. These
Mhm.
slides, I have not created them. They are World Health Organization slides.
Sure, sure.
And again, uncontrolled hypertension causes premature death, something I showed you earlier, heart
Mhm.
attack, stroke, kidney failure, blindness, and other complications we discussed just now about that.
Mhm. Mhm.
So friends, I hope you like our videos while we are talking to Dr. Abhay. In case you have any comments or feedback, please do enter those in the comment section below. You can also post your queries if you have. I'll try and get the answer to your queries from Dr. Abhay in the upcoming videos. Till then, see you. Bye bye for the next video.